Welcome to the What If It's Not Depression podcast. I'm your host, Dr. Achina Stein. Today, we are going to be talking to Shannon, who is a licensed independent clinical social worker and AASECT certified sex therapist. She works at the intersection of mind and body to help clients struggling with sexual function issues, including low desire, anorgasmia, genitopelvic pain, erectile dysfunction, dysphoria, and dissociation during sex, and more. She's a proud Rhode Islander, and Shannon can be found at the Center for Growth's Rhode Island office in Providence, Rhode Island. Welcome, Shannon.
Thank you. It's so exciting to be here. I always love an opportunity to talk to other providers about sexual health and sexual function.
Yeah, and I'm really glad that you agreed to be interviewed today. I think it's an extremely important topic because it does not come up in regular doctor visits unless a person is already knowing that they have this problem and have the courage to discuss with their primary care provider or specifically seek out people like you because they figured it out. But so much time goes by that they don't even realize it. And I think it's so important because it can ultimately cause a lot of self-consciousness, loss of confidence. It shifts their identity about who they are, and then can also lead to depression. And it's not something that comes up in a psychiatric interview. Psychiatrists, unless again they're trained in this area, they wouldn't necessarily, or psychologists, or
Right.
other therapists, like they aren't necessarily trained in this area, and may not even ask the question about sexual function or dysfunction. And it's a very intimate, sensitive topic, and it's important to just let people know more about it. And I think the more education that people have, the more they'll feel empowered to do something about it. If what we discuss feels right to them, it's like, oh gosh, that makes so much sense, and now I'm going to get help from Shannon. Right.
Yeah. And I think that's a big part of why I became a sex therapist. I got trained and certified through the American Association of Sexuality Educators, Counselors, and Therapists after being trained as just a regular talk therapist. Because I agree with you. I think it is really difficult for folks to talk about sex, even with their partner sometimes, let alone a healthcare provider that they don't know very well. And healthcare providers are people too, right? We can't help but absorb some of that discomfort or some of those biases just as we move through the world as people. And unless you have that specialized training, it can be really uncomfortable to ask your patient, so how's your sex life going?
Right.
So I'm thrilled to be here today to talk to you a little bit more about what are some of those common areas where we see sexual disorder or sexual dysfunction in folks, and for folks who are listening, to let them know that you don't have to be stuck this way. There's absolutely a list of leads in terms of what's going on to help you get a better understanding, and there's something you can do about it to feel more satisfied with your sexual self and your sexual relationships.
Right. Yeah, it's a very difficult topic. And many doctors have only 15 minutes. And this is a topic that can probably only come up when you're in a place of trust with that provider and are allowed the time to have the discussion, right? So yeah, so why don't we just first talk a little bit about what sexual desire is and not, and talking.
Yeah.
Why don't we just
Find
start with
some.
the definition, because I think some people may not even know that yet, and
Yeah.
so that we have a starting place of our discussion, and maybe even if there's definitions that need to be described, then let's start there. Let's start as if nobody knows anything about
Yeah.
about
Yeah.
this topic.
So I'll start by saying that everything that we're going to talk about today like sexual disorder and dysfunction, is something that can be found in the DSM, which is like the big manual of psychological disorders. That's how clinicians treat clients for mental health issues. We look in that manual, there's a disorder, and then there's a bunch of criteria underneath that for what symptoms to meet that disorder.
Yes, I brought that book up again. It's the Diagnostic Statistical Manual, the DSM, and there's many versions of it. And so,
and I think we could get into like the pros and cons of using that text. But for our purposes today, I think it's really useful just to help us organize and understand how to think about these sexual issues. So in the DSM, we categorize sexual dysfunction into problems with 4 different areas. So first, we've got problems with desire, problems with arousal, problems with orgasm, and problems with pain. And I'll get into the definitions of each of those in detail. I think, as you said, a lot of people use desire and arousal or desire and pleasure interchangeably. And it's important with our partners and with our healthcare providers that you're able to be specific about what it is that you're experiencing and what's difficult. So when I talk about desire, I mean that intellectual, emotional anticipation of sex that's positive, right? So the idea that, oh, I would like to have sex right now. That would be a fun thing to do, a good way to spend time. That's desire. It's that emotional, cognitive anticipation. Then we've got arousal, which is the physiological response of the body as it prepares to have sex. And there are a lot of components to arousal, right? We've got the production and distribution of hormones. We've got the production and uptake of neurotransmitters. We've got blood flow, and blood flow is what allows erectile tissues to become erect. It's what allows lubrication to happen, because that's also like an osmotic process that happens thanks to blood pressure. And then we've also just got like muscle responsivity, all of that stuff. So all of those things are happening when the body is aroused, and all those things are happening to allow us to actually have sex. And so issues with arousal are issues that are related to all of those physiological processes. Same thing with orgasm, right? So orgasm is the product of all of those things in arousal happening and happening correctly, leading up to a buildup of muscle tension and then a release of that muscle tension, as well as like more release of neurotransmitters like dopamine, oxytocin, serotonin, all of those good things. And then finally, the last area where we often see dysfunction and disorder is pain. And pain can impact any of those 3 other categories behind it. For folks who have chronic pain that's maybe not sexual in nature, they know it really can just impact so many different areas of your life. And so when we're talking about pain in relation to sexual function, we're usually talking about genitopelvic pain. So pain that's impacting either the external genitalia, internal genitalia, the pelvic floor, which is that sort of basket of muscles that holds all of those reproductive organs in, or pain in the bladder. And we can talk a little bit more about later on about how all of those things can impact not just your sense of self, but your sexual function. So those are the 4 areas. We've got desire, that intellectual, cognitive, positive anticipation of sex. We've got arousal, the body's physiological preparation to have sex. We've got orgasm, again, that like physiological release and result of sexual stimulation. And then we've got genitopelvic pain.
Great. Yeah. And those are, each of those areas can probably have multiple podcast interviews about. So we're going to be trying to cover a lot there in a short amount of time. And maybe if we need to, we'll have another episode with you.
Yeah, you don't have to ask me twice.
So that would be great. Yeah. So can you talk more about some of the common causes of of low sexual desire? Let's just start with that.
Let's start at the beginning. So I think with desire, there's a lot of actual crossover between issues with desire and issues with mood here. And that's because, as I mentioned, like desire is such a cognitive function. It is about our like thoughts and feelings about
Mm-hmm.
having to have sex. I think most commonly when I see folks in my office, whether they're in a relationship or on their own, and they're saying, I have a problem with desire, really what we're talking about is an issue and expectation. I'd say more than half the time. It's not that something's actually going on in their body. It's an issue with what they expect of their sexual selves and their sexual performance. I think a lot of folks move through the world because of movies we see, because of how we talk about sex in the media, thinking desire should be spontaneous. It should be something that just sort of appears from the sky and you feel it and you have it for your partner. And then it's time to go to town and have a great time. And if I'm not spontaneously having that feeling, something is wrong with me, or something's wrong with my partner, or something's wrong with my relationship. And this is a big deal, right? People can walk around feeling really bad about themselves.
Absolutely.
You can feel that they're broken. This can lead to some of those depression symptoms that we've talked about, really just not liking yourself or not feeling like you have a place in the world. So I think it's really important for those clients that we talk a little bit more about how desire actually functions, right? I think some people experience spontaneous desire, but a lot of people don't. And that doesn't mean that anything is wrong with them. And the reason that, some people might experience it, some people might not, is because of the dual control model of how desire functions. And basically what we're talking about is that we have two separate systems that process and interpret sexual stimuli as we move through the world. So this is happening in our brain. We've got a sexual excitation system and we've got a sexual inhibition system. So that excitation system takes in stimuli, maybe the smell of your partner's cologne, maybe how your clothing feels against your skin. And it says, oh, I like these sensations. These are signs that it's a good time to be sexual. That system is positively interpreting that data to say, yes, go ahead, let's go have sex. Your sexual inhibition system takes in that same data or other data and says, actually, you know what, now's probably not a good time. I hear my baby crying. I'm really sweaty. I haven't slept all day, right? And tells you like, maybe now's not a good time. Let's pump the brakes and come back.
Right.
And people can have one system that's more responsive than the other. They could have both really responsive or both really unresponsive. They operate independently from each other. But you'll notice, right? Like, I think if you have a strong excitation system that's really responsive, it might be more easiest to have that like sense of spontaneous desire. Maybe it only takes like one little sexual stimuli for you to feel ready to go. But for a lot of people, that's not the case, right? They might have a strong inhibition system or a less responsive excitation system. And so they need lots of stimuli before their brain puts the pieces together and says, now's a good time. Let's do this.
Right. Yeah. And I think it's important to say that there's a wide range of normal, right?
Totally.
Yes.
Yeah.
And just because there's not necessarily the same, there might be a mismatch between partners, that it's not necessarily true that one, even though let's say one person wants to have sex every day and another person wants to have sex once a day, once a week, right? Then that doesn't mean that they're one of those people are not normal. It's just that that's their level of sexual function, and it's just finding some middle ground on some level. It's finding some kind of compromise that satisfies both people in the relationship.
And I think what I end up talking to a lot of folks about, if they have responsive desire, right, which is I don't have spontaneous desire. The idea that I would like to have sex only happens after I've started to experience some arousal. I had enough like sexual stimulation that my body is physically responding, and then my brain responds to my body and says, well, yeah, this would be a good time. And so for a lot of those folks, I say, one, let's talk about those expectations of self. Two, let's talk about communication with your partner.
Right.
And three, let's really focus on like how you can tune into your body, how you can experience pleasure, because that's what's going to allow you to experience desire.
Absolutely.
Right? Not
Absolutely.
always in that straight line of first desire, then arousal, then orgasm. Sometimes it's arousal, then desire, then orgasm for some folks.
Exactly. And plus, I don't think people realize just how much stress in a person's life shuts down their hormones. So when you're in high stress mode, your cortisol levels are very high. And then that shuts down your sex hormones. And then, that's a whole piece that's part of the orchestra when having sex in all those areas that you just mentioned, the 4 areas that you mentioned. And it doesn't necessarily mean it has to be to the point of dysfunction or a disorder, but just it could be enough to disrupt your relationship and cause a different cycle of issues that can lead to low confidence, not feeling good about yourself, and a barrier between you and your partner, and then leading to depression or anxiety, right?
Absolutely. Yeah, I think because of how central sex is seen in our culture to being healthy and being in a healthy relationship, people can feel like something's really intrinsically wrong with them if they are not having sex the way they imagine they should be having it.
Right. Or they start thinking, oh, you must be having an affair. I cannot tell you how many people have
Yeah.
made that assumption, and it's like, no, that's not true, but they're not believed, or they're, the female partner in the relationship might be going through perimenopause or menopause, and there's a change in hormones. So there's usually a hormonal explanation or a stress explanation, or just even having comorbidity. Sudden changes in your health can absolutely affect your sex life. It's important to keep in mind all of these things and it could be a slow change. It doesn't have to be a sudden change. So it's looking for all those puzzle pieces that could be impacting a person, and then basically connecting those dots, and then sort of presenting it in that fashion, as opposed to, no, I'm not having an affair. I still love you. I still want to have a relationship with you. We just need to figure this out together and find another way. Sometimes people are spontaneous, but then as they grow older, that kind of shifts and changes. And so your sex life can change over time in a relationship that's still loving and caring.
Yeah.
Right.
Yeah. Yeah. And that change does not have to be for the worse. If you are making intentional time to think and talk about it with your partner. I think the other piece, or the other common cause I see of issues with desire is actually there's an issue with one of those other 3 areas, and sex is not fun, right? It doesn't feel good, maybe because there are issues with arousal, maybe because there's an issue with your partner and you and your partner aren't able to communicate well about what actually feels good in this moment, maybe because you're experiencing that genitopelvic pain we've talked about. But I will also see a lot of folks who come in and say, I don't want to have sex, something's wrong with me. And then when we talk about it, the sex that they're having is not feeling very good. And I think that makes a lot of sense, right? We often avoid things that we don't enjoy doing or that actively make us uncomfortable.
Yes, well, if it's causing pain instead of pleasure, I mean, that's like a no-brainer, right? And so, but it's coming to a place of figuring that out, articulating that, and then coming up with a different way, because it doesn't have to be there's other ways to get pleasure with your partner other than having sex. And sometimes that might be, an alternative in the interim, if there is depending on what the situation is, it might be temporary or chronic, and until that issue is addressed and treated, you might have to use other ways of connecting.
Sure. Yeah. Yeah. I think that oftentimes folks can also come in with a pretty narrow definition of sex. Sex has to involve some kind of penetration.
Mm-hmm.
And so it can be really important to think about what is it that's meaningful to you about sex, and how can we prioritize that without necessarily prioritizing this activity that is painful or distressing for you.
Right, right. Yes. So, one of the things that we mentioned earlier that I think is really important to talk about is the vulvo-vaginal pain or pelvic pain. And so can you talk more about the common causes of that?
There's so many. We
Mhm.
could spend many hours talking about that.
Right.
But I'll give a broad overview. So
Mm-hmm.
with genital pelvic pain, uh, you might say, oh, this applies to me if you experience pain during sexual contact, right? That's what we look at within that DSM definition, but also during non-sexual things, right? Non-sexual penetration, like using period products or going to the bathroom, or even things like where there's contact with the vulva, like riding a bicycle or wearing certain clothes. Um, if you're consistently experiencing pain with those things, chances are you have some form of genital pelvic pain, and it's important to get a referral to talk to a pelvic pain specialist,
Mm-hmm.
because not even every gynecologist gets training in this area, and they may not be able to point you exactly in the right direction. So you can figure out what the physiological cause is. With all forms of genital pelvic pain, there is some physiological component. I think in my training, we talked about, there are some that are just psychosomatic, that are psychological in origin. But I think even for those clients, you're seeing a physiological response to stress that then is growing on its own over time. And so it's important to have a doctor and oftentimes a pelvic floor physical therapist as part of that holistic treatment team to
Mm-hmm.
help you stop some of those things from continuing. So broadly speaking, when we talk about genital pelvic pain, we're talking about potentially issues with muscle pain. So those muscles in the pelvic floor, often going into hypertone. So just being like really tense all of the time, so that it can feel really, really painful, sometimes even impossible to have penetration just because there's so much hypertone and tension. And there can be different reasons for that muscle tone issue. Could be stress, right? When we're feeling stressed, we often carry that stress in our muscles, just like how I carry tension in my jaw. If I'm stressed, I have to remind myself, unclench, release your jaw, release your shoulders. That can happen in your pelvic floor too,
Mm-hmm.
where you get stressed, and so you're tightening those muscles, and that can lead to pain. And that stress could be related to trauma, or could just be that you are experiencing a lot of stress not related to anything with sex. And it's really focusing on that pelvic floor. So we've got muscle pain. We've got nerve pain. So proliferation of nerves that process pain in the vulva or the vestibule, which is the opening of the vagina.
Mm-hmm.
And those things can happen for different reasons. You can be born with the proliferation of those nerves. Nerve growth can happen in response to a lot of things like injury, even medication that folks are using.
Mm-hmm.
I just read a really interesting study about the link between proliferation of nerves and hormonal birth control, um, and also treatment for like yeast infections, things like that. So I say that not to tell anyone to get off their birth control right now, but just if you've been experiencing a lot of nerve pain, it might be worth talking to your doctor, your functional medicine provider, just about all the different pieces of that puzzle.
Absolutely. Absolutely. Really important to bring up these things and not assume that it's in your head for one thing, but that there might be some real cause from a medication, like you mentioned, or something else. Yeah. So, were there any other causes that you wanted to mention?
Last
Yeah.
causes of skin issues, so lesions in the skin, um, issues like scleroderma, things like that. And then also like inflammation broadly, and also inflammation specifically of the bladder, like interstitial cystitis, um, endometriosis, things like that.
Yeah, and I was going to mention endometriosis, but I wouldn't be surprised if people also had some GI issues like severe constipation, also SIBO, small intestinal bacterial overgrowth, any kind of inflammation in the pelvic girdle, but also even L4, L5 dysfunction. Anytime if you had some kind of injury to the spine, it'll affect all the nerves that supply the region. So, and it doesn't have to be a bulging disc. It could be that you had a slip and fall, and your pelvis is out of whack, so to speak, and it needs to be back in alignment. And I can't tell you how many patients I've had who have had, urinary frequency and urgency and feeling like they had a urinary tract infection, but didn't because of multiple urinalysis, and what it's usually do in that situation, it's your pelvis is off. Sometimes it's just from bending over and picking something up, and your pelvis kind of gets tweaked, or you're picking something up heavy on one side, and again your pelvis gets tweaked, and it impinges on the nerves of the spine, and that leads to a bladder dysfunction, and it feels like you have bladder infection, or so with urinary frequency but no true infection. Ultimately, if it's not taken care of, it can result in an infection, but it's just a matter of getting those hips back in alignment. And seeing a chiropractor or an osteopathic physician will be a way to have that evaluated and
I
fixed.
think that's such a great point, that it can feel overwhelming to folks to figure out next steps sometimes, because with a lot of these things, the genitals themselves may look pretty healthy,
Right.
right? They may not look like there's actually anything wrong other than maybe a little bit of redness. And I can't tell you how many clients I've had who've gone to their gynecologist, and the gynecologist says, it looks normal. You should see a therapist. You're probably anxious or depressed.
Right.
And I'm happy to work with those folks, but it's more than just that kind of stuff. And so
Yeah.
it's so important to be able to describe very specifically, these are the sensations I'm feeling. I'm feeling sharp stabbing pain. I'm feeling burning. This is where on my body I'm feeling it.
Right.
So you can advocate for yourself in those spaces to get those referrals you're talking about. Because who would know that you go to a gynecologist for an issue, but actually you need to go see a chiropractor?
Right. Right. I mean, there's a lot going on down there, a lot going on. You've got your GI tract, the bladder, you've got your sex organs. There's this whole pelvis that's connecting nerves from the spine. You have the ligaments holding your pelvic cage together, and there's muscles there. It's all core. There's so much going on. And, I wrote in my book about a friend who had serious pelvic pain, and They, it was not being addressed at all. And I knew just from what she was telling me that she had a pelvic subluxation, and, osteopathic physicians and chiropractors are well aware of it, but MDs are not. They're not trained. They're not trained to understand that. And so ultimately I had her see one of my colleagues, and within a couple sessions, she felt significantly better. So, it's important to understand that everybody has their training, and they might be trained really well in it, but one provider can't know everything. And I think it's always important to have an open mind that, well, maybe I don't know this, as opposed to, nope, you don't have this, it's all in your head, and it's just, okay, you check out fine for me, but this is my specialty and I don't know if there's something else going on. Why don't we have you see uh this person or that person that might specialize in these areas, right?
I think that humility and awareness of scope is just such an important part of practice. And
Absolutely.
it can be hard to remember sometimes just because of our own stuff about failing or
Right.
needing to be an expert.
Yeah, absolutely. Absolutely. So I think it serves the patient the best if we try to keep trying to figure it out, but not necessarily know all the answers,
Yeah.
right?
For all of this stuff, if you feel distress about what is happening in your sexual experiences, whether it's because you're having low desire or you're not able to experience pleasure during sex, you're having trouble with arousal, or because you're experiencing pain, um, a really good first place to go is just to find a sex therapist that's ASEX certified, because like we're talking about, we have all of the questions to figure out, okay, what exactly is going on here? And what's the list of leads we can put together to then find the exact right treatment team and treatment approach for you. And sometimes it's just the sex therapy, which is like talk therapy with some behavioral interventions you take home and try. Sometimes it's more involved. We need the chiropractor, or we need medication management, or we need pelvic floor physical therapy. So there can be a lot of different components to all of that. And all of that also can shift just depending on what the mood stuff is that we're seeing. Because as you mentioned before, I think it can be really easy for depression to cause sexual dysfunction, and for sexual dysfunction to cause depression and other mood disorders, right? It can be kind of that
Right.
cycle.
Absolutely.
And so I just think that's another reason why sex therapy can be such a helpful tool, because you're getting that psychological component, treating some of those symptoms. I think one of the most important things I work with folks on when they're experiencing depression, whether it's chicken or the egg, regardless of what comes first, I think when we experience depression or we experience anxiety, often it impacts our ability to be in the present moment. Depression often makes us cognitively either focus on the past. These are some things I've done wrong. These are some things I didn't have control over. These are some things I feel shame about. I'm really focused on that. Or the future. These are some things that will go wrong or could go wrong. And what am I going to do when that happens?
Right.
And we're spending all of this cognitive energy rehashing that stuff, trying to protect ourselves from future pain. But it's really hard to enjoy sex in those moments, right? Because to sexually connect with someone, you have to be able to just focus on the present moment. If you're thinking about yesterday or later today, how are you going to know what's going on in your body right now?
Right.
And so I think it's really important for all of these issues that we're introducing some of that like mindfulness work to help people stay present focused. And that can be really impactful for depression. And it's really impactful for sexual function. So it's a nice kind of twofer that treatment wheelhouse.
Yeah, and stress reduction too. I mean, having sex is actually it's a great way to release stress, but you also have to be in a place of being present and relaxing your body to enjoy sex, and enjoy that time with your partner. And I think it's really important to look at the factors that might be impacting your ability to manage stress. And so it helps the mind body connection, and stress reduction techniques really will help everything that you're discussing, right?
Yeah.
So yeah. So we're running a little bit out of time. So I do want to just talk about a little bit more about any mindfulness techniques that you feel that is specifically impactful, and maybe specific for these areas. Is there something that you think that people can, even if they feel like this is an issue for them, that they could actually start doing on their own?
Mhm. Yeah. Yeah. So, um, this is something I would recommend to anybody, just as one, because it's going to be helpful to practice some of the skills, but also we can just look at it as an assessment, like a
Mhm.
little experiment to gather some data to get a better sense of what's going on in your body and your brain in a sexual.
Mhm.
And I'm gonna talk you through an exercise I will often give to partners, although certainly you can make modifications to this to do this on your own. Um,
Mhm.
and um, Oftentimes I will ask partners just to um, take some time to touch each other mindfully. So you to begin, um, set aside maybe like 10 minutes of time where nobody's going to interrupt you. Your phone's turned off. If you're going to use the phone as a timer, you're turning off your notifications. And we're really just going to focus on, can I can I touch my partner without having a lot of chatter in my mind? So for 5 minutes, partner A is going to touch partner B, just on the back. So this is not meant to be like a sexual or erotic exercise. Again, it's a little experiment to learn a little bit of what's happening for you in these moments. So taking some time to just gently explore your partner's back with your fingers, paying attention to what are the textures you can feel, paying attention to how does temperature vary as you're moving around their back, and paying attention to tone, like how does muscle tone vary as you move around the back. So I'm picking these three things kind of arbitrarily, but there are three focal points to help you stay focused and stay present in the moment as you're touching your partner. So you're paying attention to these things, and you're just letting yourself kind of touch for what's interesting to you, like what feels good. I think a lot of times, as you do this exercise, you may notice yourself wondering, well, how does my partner feel about this?
Mhm.
Are they enjoying this touch? What do they think? Are they bored? Should I be going faster? Right? It can be
Mhm.
just so easy to have that mental chatter.
Right,
Um,
right.
Another thing folks might experience might be, I don't know what to do. I don't know what's interesting to me. I don't know if I'm having a good time. Am I doing something wrong? So if any of those thoughts come up, just notice them, right? We're gathering this data for a clearer picture. What are the kinds of thoughts I'm having? And then go back to what's the texture, you can feel the temperature, the tone. And then after 5 minutes are up, you switch.
Mhm.
Person who's receiving touch, you're just focused on feeling that touch and not evaluating it. I think it's really common when our partner's touching us to say, that feels good, that feels bad, that's a good touch, that's a gross touch. And of course, if your partner touches somewhere on your back that's painful to you, let them know. But otherwise, we're just trying to hang in that objective space. We're noticing what kinds of thoughts come up, and we're coming back to paying attention to the sensation. So this is a way to practice being mindfully present with your partner. But now, coming out of that exercise, you've also got some information. How do I feel when I'm touching my partner? How do I feel when they're touching me? Where do my thoughts tend to go when I'm touching my partner? What are the things that I'm often experiencing in these moments of intimate connection with my partner? And you can bring that to a sex therapist to help you come up with a more specific plan for whatever your specific issue is and what you want to do.
That's excellent. That's an excellent exercise. It's just gathering information in a low stress way. And it's being really curious about how you interact with your partner. I think it would be, an easy task to do, hopefully, right? If it's not easy to do, then there's maybe another problem, but I think that should be pretty easy to do.
And for folks that it's not easy to do, that's still useful information, right? I would still bring that to your sex therapist and say, I was too anxious, or I had pain, or I had too much embarrassment. I think all of that is important to know so we can help you figure out what's causing some of those issues.
Right, exactly. It's another layer that needs to be addressed as well. So it's definitely, what a great idea. I really appreciate you sharing that today. Is there anything else that you would like to add that you think is super important for people to know that we had not talked about?
Yeah. I want to give my ACE caveat, which is just that, we've talked a lot about sexual disorders today. For some people, they don't feel any distress about the fact that they have no desire. That's actually a core part of how they see themselves as asexual. This podcast was not addressing those issues. I think if someone is noticing like, oh, I don't really enjoy sex, I don't have a lot of distress about it, I'm not really sure why that is, still come to a sex therapist. Let's talk about it. But everything that we talked about today is for folks who experience distress about the fact that they're experiencing these issues.
Right. And that might be right for you.
Yeah.
And that's fine. But sometimes there's conflict that occurs with a partner who
Totally. It's having a conversation about that as well.
Absolutely. I'm so glad you brought that up, because it's really important to include that as well.
And then just generally to say that, I think so many folks I talk to about sexual disorder or dysfunction issues feel really helpless and feel really alone. Like they are different than everyone else. And I know I have a skewed data set because of my field, but I don't think you're alone. I see lots of people with these issues every day. And I think the most important thing someone can do if they're feeling like they have an issue with desire, arousal, orgasm, or pain is to reach out to their healthcare provider, or specifically a certified sex therapist.
Right.
To figure out next steps for that.
Great. Where can people find you, Shannon? Shannon Oliver O'Neill.
That's me. Yeah, Shannon Oliver O'Neill, licensed independent clinical social worker. I'm over at the Center for Growth. You can visit our website at www.thecenterforgrowth.com. And we're over on 173 Waterman Ave on the east side of Providence if you want to book an appointment.
Great. Awesome. Thank you so much for today and your sharing your incredible knowledge on this issue. I really appreciate your time. And thank you.
Yeah, this was so fun.